Inguinal ligament is a thickened and folded, slightly curved lower border of the aponeurosis of the external oblique muscles. It extends from anterior superior iliac spine to the pubic tubercle and lies beneath the fold of the groin. Lateral half of the inguinal ligament is rounded and is obliquely placed, whereas the medial half is grooved on its upper aspect and is almost horizontal. Its lower border gives attachment to fascia lata, whose traction makes it convex downward. Upper surface gives origin to internal oblique, transversus abdominis, and cremasteric muscles. Medial half of the upper surface of the inguinal ligament forms the floor of the inguinal canal, and this canal transmits spermatic cord or round ligament. Extensions and clinical relevance of inguinal ligament. First, the lacunar ligament. It is a triangular horizontal extension whose apex lies at the pubic tubercle. Its base forms the lateral border of the femoral ring, and its posterior border is attached to the medial part of the pectineal line. Second extension is pectineal ligament, which is also named as ligament of Cooper. This ligament extends from posterior part of the base of the lacunar ligament along the superior ramus of the pubic bone and is attached to the lateral part of the pecten pubis or pectineal line. Third is the reflected part of inguinal ligament. Fibers from the lateral crest of the superficial inguinal ring pass upward and medially. They travel between the superficial inguinal ring and the conjoint tendon and ultimately interlace with those of the opposite side at linea alba. Notable are the mid-inguinal point and middle inguinal point. These are two terms which have got clinical relevance. Mid-inguinal point is the point midway between anterior superior iliac spine and pubic symphysis. That is, it is midpoint of the inguinal region. Its clinical relevance is that this is frequently used to locate the femoral artery which passes underneath this point. Head of the femur lies underneath the artery. The middle inguinal point is the point of middle which lies at the middle of the inguinal ligament, or it is the middle point of the inguinal ligament. It lies slightly lateral to the mid-inguinal point and femoral nerves passes underneath.